Hi, my name is Kat Brigham. I'm the Board of Trustees Chairman for the Confederated Tribes of the Umatilla Indian Reservation.
My name's Dr. James Wind. I'm the medical director at Yellow Hawk Tribal Health Center.
I'm here to let you know that the Board of Trustees has taken the coronavirus very seriously, and because we've taken it so seriously, we have closed down our casino for 48 hours, our education facility, and our senior center, so they can have time to clean and to try to prevent any spread of the coronavirus. We've also passed a resolution to say that we've established a public health incident command team, which is made up of all of the Yellow Hawk departments and some of the tribal departments to see how we can try to prevent and educate our tribal community about the coronavirus.
We are facing unique times right now. We're confronted with a virus that we didn't know existed until December of last year. This virus is new. It's a type of coronavirus we've never seen before, and we're learning more about this every day. I'd like to talk to you a little bit about the virus. It causes a respiratory illness very much like influenza. The symptoms can be a cough, shortness of breath, a light fever. Most of the time, it is mild. Occasionally, people will require hospitalization and further testing. Rarely, it can cause death. I'd like to talk a little bit about prevention. You have to cover your sneezes. Sometimes you're going to have to cough into your elbow. For those people that like to hug, we're going to have to bump elbows occasionally. Handshakes, probably not a good idea. We'd like to decrease the transmission of this disease. Hand washing is one of the major things that we can do. This is not just running your hands under cold water for a few seconds. It's using soap and very hot water, washing your hands for at least 20 seconds. You can do it a number of different ways. Do the spider, washing on the in between your fingers and then rinsing your hands off. If you do not have soap and water, you can use alcohol-based hand sanitizers, but soap is a little bit better. Another thing I'd like to talk about is close contact. Are you in close contact with another person? That's 3 to 6 feet connection to another person within for 1 hour. So this is hard. This is a virus that is fairly hard to transmit, and you're not going to get it just by casual contact. If you come into Yellow Hawk, you're going to see many changes that are going on right now. We take this very seriously, and we're here to help you in case you have any type of illness, not just coronavirus. We're worried about all your other medical problems at the time. When you walk in, you will be directed through kind of a channelizing area where you'll be questioned by a person up front who will be asking you several different questions about where you've been and what your symptoms are. If you have any significant symptoms, upper respiratory cough, fever, you may be asked to have a mask placed, and you'll have to wash your hands. We'll then take you back into a room, and you may be asked to go into an isolation room. We may be having protective gear on also, a mask or other gear. We'll evaluate you and see if there's a problem that needs further evaluation and testing. All other problems we can take care of right here, and we'll try to do that as soon as we can.
The Board of Trustees passed a resolution to bring the Yellow Hawk and our tribal departments together to help educate and get information out to our tribal community, which it means not only the tribal members, but everybody who lives on our reservation about what they need to be doing to be healthy, to prevent getting the coronavirus.
Let's go over some of the details that will help you prevent the spread of these germs. Avoid close contact with people, especially if you're ill. If you do sneeze or cough, try to cover your face. If you use tissues, try to get those into a wastebasket as soon as possible. Avoid touching your eyes, mouth, face. We do that sometimes when we're nervous. Decreases the transmission from a contact surface into your upper airway. Clean and disinfect commonly used surfaces as much as possible at work and at home. If you are sick, it's okay to stay at home. We can help you if you come in, or if you need to have a note for work, we can make sure that you're going to be covered for the problems that you have. If we think you have the illness, we may ask you to be off work up to 14 days. We'll have you call and talk to your primary care provider or one of the nurses here. We can either guide you into this area, you may be asked to stay in your car, or go to the hospital directly if we feel you have severe illness. Remember to wash your hands for at least 20 seconds, and we're here to help you no matter what type of medical problem you have.
I think it's important to say that both Yellow Hawk and the tribe and the casino, everyone is saying, and even Cayuse Technology, everybody is saying, if you're sick, stay at home. As, that's one of the things we're saying to help prevent the spread of any virus. It could be coronavirus, it could be flu virus, but if you're sick and not feeling well, stay at home. The thing we want to get out to everybody is to let you know that yes, this is a virus, but at the same time we can work together to prevent the virus from spreading by working together and taking care of ourselves, being healthy, taking care of each other so that we're not spreading the virus, we're helping each other to be educated and be aware of what we need to be doing.